Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Khushali Jhaveri, a hematology oncology physician. Today's Kevin MD article is What the Research Really Says About Infrared Saunas. Khushali, welcome to the show.
Thank you, Kevin. Thanks for having me.
All right, so
It
let's
is,
start by briefly sharing your story and then what led you to write this article on Kevin MD.
yeah. So, as you mentioned, I'm a hematologist oncologist. I work as a lymphoma expert at Indiana University. I treat wide spectrum of B cell lymphomas, and my research focus is on body composition and how specifically muscle mass and sarcopenia, that is loss of muscle mass, impacts outcomes for B cell lymphomas. And my story. So, in terms of medical journalism, when I was in fellowship, I had a privilege of working at ABC News.
Mhm.
And that's where I learned how to translate really complex scientific information into a language that broad audience could understand. And I helped translate noteworthy research for platforms like Good Morning America, multiple shows on ABC News, and that really drove my passion for medical journalism. And what I realized during that time was that when it comes to high quality science reaching the public, there isn't much physician voice out there.
Mhm.
And that led me to continue writing. And I've written for your platform, Medscape, and more so now working as an associate editor for American Society of Hematology's magazine, which is called ASH Clinical News.
Wonderful. And I think that is more important than ever, especially with all the misinformation that is currently going on and the fact that healthcare has become so politicized. So, congratulations on doing what you do. We need more physicians going into media.
That is wonderful, and you're exactly right. And yeah, I think with the Kevin MD article, one of the things that has consistently stood out for me is that when it comes to high quality science, how little physician voice is there between the science reaching the public. And what I've noticed is there's often a big gap between what's marketed and what data actually shows. And for me, I think sauna and more so infrared sauna kept popping up on my Instagram feed over and over again, and with really confident health claims. And so I was definitely intrigued, but I was also skeptical. So one day, out of curiosity, I wanted to experience it myself, and I drove to an infrared sauna studio. And what struck out was not just the entire experience, but the breadth of health claims that were being made,
Hmm.
from detoxification to calorie loss, almost as much as like 400 calories per session, and then enhanced recovery, improved sleep, a lot of those things. And so I think the Kevin MD article came out of that process when I wanted to dig deeper into research. And my goal was to bring physician lens to a topic that a lot of people were already engaging into and bridge that enthusiasm with evidence in more accessible way.
All right. So, before we talk about some of that evidence, just tell us what exactly is an infrared sauna? I see sometimes advertisements like you do, but just for those who aren't familiar with that, just tell us exactly what that is.
So, infrared sauna basically is based on the principle of passive heat exposure. And one of the recurring themes that keeps popping up when you see about infrared sauna is the concept of heat shock proteins. And what these heat shock proteins are, they are proteins which are produced by our body in response to stress, including elevated temperatures. And their role is essentially cellular housekeeping. So when we expose ourselves to passive heat exposure as an infrared sauna, what happens is our body produces these proteins, and these proteins help other proteins to fold correctly, preventing cells from experiencing stress and also assisting in repair. And so, what happens over time is that our body gets better at handling stress. With sauna, you produce these proteins, and over time, you learn how to manage inflammation better. There's enhanced cellular recovery, and also the integrity of cells is maintained better over time. And emerging research is also showing that it might actually help with even enhancing longevity.
All right. So after looking into the data, you talked about a study that looked at some of these claims. So what does the evidence say about the claims of these infrared saunas?
So I think that really surprised me. I was a skeptic before going into it. And once I really looked at the data, I have found it very compelling to actually engage in it with sauna myself. And one of the studies that really struck out was a study which was published in JAMA Internal Medicine. And in the study, Finnish researchers, what they did was they followed around 2,300 middle aged men for over 20 years. And what they found was that men who engaged in sauna use 2 to 3 times per week compared to men who engaged in sauna use just once a week, they saw significant improvement in cardiovascular outcomes, almost 22% decrease in sudden cardiac death, 23% with coronary heart disease mortality, and 27% with overall cardiovascular outcomes. And with even increased use with men who were using sauna for 4 to 7 times a week, the benefits were even more substantial, including almost 40% reduction of death from any cause.
Hmm.
And not just the frequency of sauna use, the duration of sauna use also mattered. With men who were using it more than 19 minutes, they had much significant health benefits compared to those that were using less than 11 minutes. And one thing I think is important to know is that most of these claims come from Finnish sauna use rather than infrared sauna use. Infrared sauna is somewhat, they might have overlapping physiologic pathways, but it is mild thermal stress. So we can extrapolate from the data, but the direct outcomes data about infrared sauna is still limited.
Now, what are some of the downsides to this, of going to the sauna? What are some of the side effects? Did the studies show any risks to those using these infrared saunas?
I think, it's not something which is one size fits all intervention. I think before engaging in any wellness trend, I think personalizing your risk and benefit is very important and talking to the physician. So, for example, if someone who already has a cardiovascular disease, I think for them it might be risky. Someone who is pregnant, it might be risky too. And say if you have dehydration and during sauna you're going to lose a lot of electrolytes and water, so it might cause dizziness. So it's really important to keep yourself hydrated, make sure your electrolytes are okay, and also talking to your physician about your personal individual risk versus benefit.
Now, what's the potential mechanism where these infrared saunas can decrease the risk of cardiovascular disease and outcomes? Is it the fact that these shock proteins help with inflammation? Did the papers speculate on a potential mechanism?
I think it's mainly about the heat shock proteins. And we have to remember that these are association studies. The researchers did follow these men over 20 years. So there is a component of prospective element to it. But again, at the end of the day, these are association studies. So it is really hard to pinpoint the exact mechanism as to why people are benefiting. But it's more so from heat shock proteins and your body's ability to handle stress and inflammation better.
So these are more observational studies. These weren't double-blind, randomized controlled studies.
No, they were not.
So you mentioned that you're familiar with these infrared saunas. Who would be the best type of patients who may benefit from these?
I would say anyone who is healthy overall should be able to benefit from infrared sauna. I think the data is pretty, at the end of the day, as I mentioned, these are observational studies, and so it is hard to have cause and effect. But based on what data I've seen, I think anyone who is able to engage in infrared sauna would benefit from it as long as they don't have other comorbidities that might contradict them or might have, more risks associated with it than benefits.
And how much does a session cost typically, and is it ever covered by insurance?
I don't think it would be covered by insurance, but like most of the sauna studios are HSA eligible, so you can definitely use it as a health cost. And I think the sessions usually are around $20 to $30 per session for a 1 hour session. And I think it becomes even cheaper if you engage in some membership.
And how many sessions would you need in order to see a potential benefit according to the studies?
I think, as I mentioned, according to the studies, like even doing once a week is going
Mhm.
to have some benefit, but higher the frequency and your ability to tolerate longer sessions over time, I think that is where the highest benefit exists.
And you mentioned a difference between the infrared saunas that we have here and the Finnish saunas that was in a study. What are the differences between the two?
I think Finnish sauna operate at much higher temperature, and it is more of a direct heat exposure rather than passive heat exposure, which is what we see with infrared sauna. And I think what is, to me, more nuanced with infrared sauna is that a lot of people are able to tolerate it better because the temperature is just not as high, but it, as I mentioned, works along the same physiologic pathway of passive heat exposure and increasing your core body temperature and producing those heat shock proteins.
We've talked about how a lot of the data is observational, meaning that we can't conclude that there's a causation, but just a correlation, right? Are you aware of any prospective double-blind trials that really would pin down a potential causation for infrared saunas? What does the future research directions go? Are you aware of any work that's going into that?
Kevin, I'll be honest, I haven't come across any prospective randomized control studies in relation to especially infrared sauna and also Finnish saunas.
And in terms of what we have to look forward to in terms of the technology, could Finnish style saunas be more prevalent in the United States? What do we have to look forward to in the future when it comes to these infrared saunas?
I This is my personal opinion. I do believe that infrared sauna are just much more easier to tolerate for an individual. And so when we are looking at like, benefits over time and increased frequency, I wonder if using Finnish saunas or just this direct heat exposure with much higher temperature, I do not know if a regular person would be able to do like, 5, 6, 7 sessions a week.
We're talking to Khushali Jhaveri, hematology oncology physician. Today's Kevin MD article is what the research really says about infrared saunas. Khushali, let's end with some take-home messages they want to leave with the Kevin MD audience.
So I would say, our patients are going to engage in these wellness trends, whether we talk about it or not. And during my training, I realized that a lot of these wellness trends, or just in general lifestyle, is not covered in medical school, in formal training, but it's very much a part of our patients' lived experience. And so I believe that when patients bring up this conversation, we should be willing to engage in those conversation. And it is not to like, just endorse everything, but being able to look at the data, explain uncertainty, and able to engage in this honest risk versus benefit conversation. And so when curiosity meets data, I think that's where trust happens. And that's where good medicine is. And as for infrared sauna or just in general sauna use, as our knowledge about these passive thermal therapies continues to increase, I do believe that it might have a role, a meaningful role in, enhancing cellular integrity and even possibly longevity.
Thank you so much for sharing your perspective and insight. Thanks again for coming on show.
Thank you so much, Kevin. It was an honor and a pleasure to speak with you today.